Have you ever felt like your own body is turning against you? Especially when you reach a stage where intimacy brings more worry than joy? If that sounds familiar, you are definitely not alone. I am Dr. Titan Gray, a specialist in urology and pelvic floor surgery, and today we are back with the series Ask Anything, where I pick the most practical questions from the subscriber community and answer them every month. All right, let us jump right in.
The first question is a long one, and honestly, a heavy one. A 70-year-old member shared that he has been dealing with erectile dysfunction at a moderate to severe level. I have tried everything: Viagra, a vacuum pump, shockwave therapy, constriction rings, and nothing has improved. At my age, do I have any options left? What is erectile dysfunction? It is exactly that condition, ranging from moderate to severe. And here is what we need to make clear. Erectile dysfunction has many causes, but once someone reaches the age of 70 or above, the most common reason usually comes from the circulatory system. When I meet a patient with trouble achieving an erection, I do not only focus on the penis. I look at the entire body. I check cholesterol levels, blood sugar, and whether there is pre-diabetes or true diabetes. I check blood pressure. All of those factors must be in a safe range. The first thing I want to tell him, and anyone in a similar situation, is this: whatever is good for the heart is also good for a man's sexual function. This is not a slogan. This is basic physiology. Improving the diet and exercising correctly, especially at least 150 minutes of aerobic activity per week, helps increase blood flow, which then improves erectile function.
So in the end, what treatment options do we actually have for erectile dysfunction today? He said he has practically swept through every option, from medication to vacuum devices to shockwave therapy. So is there any hope left? First, we need to clarify this. Medications like Viagra and Cialis, meaning sildenafil and tadalafil, are still the first line of treatment and are usually extremely effective. I have talked about them so many times on this YouTube channel that I cannot even keep count anymore. Next is the vacuum erection device. The mechanism is simple. It creates negative pressure to pull blood into the penis. Then a constriction ring at the base keeps the erection in place. Many people say it does not work simply because they choose the wrong ring size, or they put it on too tightly and it becomes uncomfortable. Once it is used correctly and the user patiently gets through the adjustment period, most men achieve results that are perfectly acceptable. As for shockwave therapy, he has tried that too, but here's the key point. This method is truly useful only for mild to moderate cases. Shockwave creates tiny micro-injuries that stimulate the body to grow new blood vessels, which improves blood flow. The idea sounds impressive, but once erectile dysfunction reaches moderate severe or severe levels, the effectiveness drops sharply. The blood vessel system may already be too weakened, or the issue might lie somewhere else, such as hormones or the nerves, in which case building more blood vessels will not solve the problem. And speaking of hormones, this is very important. Testosterone needs to be checked, especially in older patients. At the same time, the entire list of current medications must be reviewed, because quite a few of them directly affect the ability to achieve an erection.
So when all of those options no longer work, what is the next step? At that point, we move on to a stronger therapy, injecting medication directly into the erectile tissue, a method called intracavernosal injections. The name alone makes everyone nervous, but the truth is that the needle is extremely small and almost painless. I have done this in the clinic for many patients, and most of them react with surprise, saying, "Wait, that is it, doctor?" This medication works by increasing blood flow straight into the erectile tissue, and let me be very clear, the effectiveness is extremely high. Inject directly into the penis, not into the muscle or the arm? Yes, it is injected directly into the erectile tissue. The strength of this method lies in its rapid action. Within about 10 minutes, the erection reaches the necessary firmness, and once the right dose is found, the results are almost identical every single time, making it very reliable. However, the most important part is dose adjustment. You cannot start with a high dose, because if it is too strong, it can lead to priapism, which means an erection lasting more than 4 hours. It may sound impressive, but in reality, it is extremely dangerous. After 4 to 6 hours without proper blood circulation, the erectile tissue can become damaged and form permanent scarring. If that happens, the patient must go to the emergency department immediately so the trapped blood can be drained. That is why in medicine we always start with a very low dose. It is absolutely forbidden to increase the dose on the same day. You must wait until the next use before raising it gradually. Fortunately, there are countless formulations and dosing ranges, so finding the golden dose is very flexible and safe.
Besides the familiar methods, is there anything else worth trying? Some people hear the word regeneration and their hope shoots straight up. But in reality, treatments like platelet-rich plasma and stem cells are still experimental, and the evidence is far too limited. Because of that, I do not consider them priority options, at least not at this point in time. However, there is another experimental direction that I actually use in clinical practice, injecting Botox into the erectile tissue. It may sound unusual, but the mechanism makes perfect sense. Botox relaxes the smooth muscle inside the penis, and that relaxation is the very first step that allows blood to rush in during an erection. The reason I choose this method is its high level of safety, along with some impressive early data. In patients with severe erectile dysfunction who are already on the verge of needing an implant, about 30% still show improvement after Botox. For moderate cases, the improvement rate is around 50%, and for mild cases, it is nearly 90%. These numbers are convincing enough for me to use this method, and so far, my patients have responded very well.
And if absolutely nothing works, at that point, we move on to the final option, but also the most reliable one, placing an artificial erectile device, also known as a penile implant. We have talked about this many times in previous episodes, and there are demonstration videos on YouTube as well. And the next question, is there a blood test that can diagnose menopause? This question confuses a lot of people, but the answer is yes. However, it is not as useful as you might think. True menopause is a diagnosis based on symptoms. When your period stops for 12 consecutive months, that is menopause. At this stage, estrogen and progesterone drop significantly, and that is completely normal. During perimenopause, blood tests are almost useless. Hormone levels rise and fall like a roller coaster. High today, low a few days later. You can test on the third day of the cycle to gather a little information, but it will not give you a clear diagnosis. So the correct approach is to listen to your body, look at your symptoms, have a detailed discussion with your clinician, and decide whether hormone therapy is appropriate. Even during perimenopause, hormone therapy can still be used if the medical history allows it, as long as the benefits and risks are carefully weighed.
To summarize everything clearly, you do not need a blood test to know whether you are in menopause or perimenopause. The diagnosis depends mainly on how long your period has been absent and on the symptoms your body is signaling. Hormone testing is truly necessary only after you have started hormone therapy, especially with gels or patches, because some people absorb them very well, while others absorb them poorly and need dosage adjustments. Thank you for being here in this video. If you want to hear the full content every week, submit questions directly, receive transcripts,